Latent TB infection. Latent TB infection is a state of persistent immune response to stimulation by Mycobacterium tuberculosis. Antigens without evidence of clinically manifested active TB. A direct measurement tool for Mycobacterium infection in humans is commonly unavailable. One third of the world's population is estimated to have latent TB infection. They don't have active TB disease but may develop it in the near or remote futures, a process called TB reactivation. The lifetime risk for reactivation for a person with the documented latent TB is estimated to be 5 to 10%. Majority develop the majority developing TB disease within the first 5 years after initial infection. However, the risk is considerably higher in the presence of predisposing factors. How to diagnose latent TB infection? Tuberculin skin test, TST, and interferon gamma release assays are tools used to diagnose latent TB. However, these tests have limitations as they cannot distinguish between latent TB infection with variable microorganisms and treated, healed or treated infection. They also poorly predict who will progress to active tuberculosis. Who should tested and treated for latent TB infection? The following patients should be tested and treated for latent TB infection. First, patients with HIV infection. Second, patients or persons with recent contact with an infectious patient. Third, patients on renal dialysis or renal patients on dialysis. And fourth, patients receiving an organ or hematologic transplantation. Fifth, silicosis. And sixth, patients initiated an autoimmune necrosis factor or anti-tumor necrosis factor TNF. So again, who should test it and treat it for latent TB infection? HIV patients, contacts with infectious patients, renal patients on dialysis, patients receiving an organ or hematologic transplantation, patients with silicosis, patient initiated an anti-tumor necrosis factor. What is the treatment or prophylaxis given to latent TB infection? The following treatment options are recommended for treatment of latent TB infection. We can give 6 months of isoniazid or 9 months isoniazid or 3 months regimen of combination of rifampicin and isoniazid. So again, regimen treatment regimen for latent TB infection include the following options: 6 months isoniazid, or 9 months isoniazid, or 3 months regimen of rifampicin plus isoniazid.